Hi, students. I want to go through this assignment here. Everybody did really well, was happy with it, but just kind of want to cover my bases on a few of these things. A lot of these here, you are going to find them in notes. So, with that, with your first patient here, Allison. So, here, you can go through the whole chart. Let me put that down here. You can go through the whole chart, like start with the overview, check things out. I do that a lot of times just to get familiar with the chart itself. So here we have the labs, go down to alerts, prevention, problems. This is always kind of nice, admitting, pre-existing, which is a lot of different ones. When we get into coding in the spring, we'll talk about which ones we are going to code, okay? Especially since they're coming in for cholecystitis. So then we have the vitals. So what you're going to be focusing on, pretty much a lot of this is going to be the notes when we did this assignment. So she has quite a few different notes. She's got discharge, nursing discharge, pathology, nursing progress notes, physician, as we go down. So let's go ahead and start. I'm going to pull up here. What is her admitting diagnosis? Okay, a couple of different things here. Nausea, right upper quadrant pain. I'm fine with anything. You go into the ER note itself. So let's just start down here. ER note presents with right upper quadrant pain and nausea. Okay, so let's go back. That was my ER note. And you can also, the history and physical, remember the history and physical is like that first thing that the physician documents before that patient gets admitted to the hospital. We'll learn about that coming up in the units. So with this, here we have the assessment, but let's go here, chief complaint. Okay, why is she coming in? So nausea, that's why I'm fine with either of those, nausea. I did put ER note, but you can find the nausea in the history and physical. Principal diagnosis, I always like to go to the very last thing here, which is the discharge summary. That is what it basically is, a summary of that patient's admission. Talks about it from start to finish, what went on. So if I went ahead with this reason for admission, discharge diagnosis, here we have some additional diagnosis, and it gives us our principal procedure. It also gives us the whole course of the patient while that patient was in the hospital. So let's go ahead and pull up. We are going to go with the principal diagnosis, cholecystitis with choledolithiasis, which is in the discharge summary note. Secondary diagnosis, as we stated, this patient had a lot going on. When I went through the other notes, the orders that we've seen, but I'm just going to go with what they had posted. If you had something different, I'm not going to tell you that it's incorrect. Okay? I'm not going to take points off. This is just what I took off from the discharge summary note. Pre-op diagnosis, cholecystitis, same thing for post-operative. So here we're going to go to the operative note, or the surgery note, I should say. Pre-op, cholecystitis, post-op, same thing. Here's our procedure performed. We have our laparoscopy, cholecystectomy. They converted it to open cholecystectomy. And the reason that they convert it, because this patient had too much adipose tissue, which that is hard to get through with a scope. So they had to take the scope out, make that incision to take the gallbladder out. All right, let's go back to this. So with that, complications, some of you did state they went from endoscopic to open. Complications, they really have to say complication of the surgery could be, let's say, hemorrhaging, something on that order. I'm okay with some of you saying that they had to convert. That's fine. When we get further, next year, this year in the spring, we'll get a little bit more factual on the complications. Okay, then your pathological diagnosis for the last one here. Gallbladder tissue fragments consistent with cholecystitis, evidence of cholelithiasis noted. So, go right to the pathology report in our notes again, and right there's our pathological diagnosis. All right. All right, let's go to patient number 2, Patricia. So with Patricia in the nursing note, I did get my admitting diagnosis assessment, which is stage 3A breast cancer. So once again, if you go in the notes, I went to the nursing admission assessment, and that is where I got my here. Sorry about that one, a little bit too far. Advanced directives. Oh, reason for admission. Sorry about that. Um, I didn't go with mastectomy deferred reconstruction just because that's going to be a procedure. We want to just go with the breast cancer. All right, so let's look at the next. Principal diagnosis, stage 3, invasive carcinoma of the left breast. That's going to be in the operative report right there in notes. Okay. With that, let's just kind of move on. Same thing, secondary diagnosis. I did go to the history and physical, which is in my notes again. With that, history of present illness, past medical history. If you have nothing for secondary diagnosis, I am totally fine with that. Because once again, are they being treated for the arthritis? Are they being treated for the constipation? No. The only thing this patient is being treated for, this admission, is the breast cancer. So if you have nothing for secondary diagnosis, I am 100% fine for that. When we do coding in the spring, we will not be coding the mild arthritis of the knees because it's not pertinent to this admission. Neither is the constipation. All right, let's go ahead and move on. All right, so here we did the radical mastectomy for the procedure. That's in the operative report. There wasn't any complications. The one thing here with the pathological diagnosis, as I stated, it's in the acceptance note, and it's breast cancer at least stage 3A. All right, so Carl Pearson, I'm not going to pull up his chart. The only thing here, left hip pain, admitting diagnosis. Principal diagnosis is the left displaced femoral neck fracture. Secondary, once again, atrial fib osteoporosis. We have our pre-op diagnosis, post-op. They're not doing surgery till the next day, so we couldn't really, you didn't put a procedure down, that's fine too. This is what's planned, but we don't have a report and no complications. So overall, everyone did a great job. Here's a little tidbit. If you listen to this, you let me know, maybe state a fact that you learned, and I will add 1 point on to your exam 1. So I will add 1 point on to your exam 1. You shoot me an email and say, Shelly, I listened to your video, and this is what I learned today. All right, everyone, have a great day.